Turning my camera on just to see if any of this growing global online village happens to be out and about. Aaron Boster here. It's January 2nd. Beautiful Thursday. I thought I'd turn my camera on and see what happens. Anybody out there in the internet? Hey Jen, great to see you. Welcome, welcome. Happy New Year's. Hey Diane, what's going on, Courtney? Ruben's in the house, what's going on? How are you guys? Welcome Shannon, welcome Michelle. Rotella team, hello. Howdy, hello, hi everyone. Polly, what's going on? Hello Jen, hello Kelly. As you jump online, tell me where you're jumping on from. Carrie Perry's in the house. Hello, Heath. Hello, Brandon. Great to see everyone. Martin's in the house. What's up, Linda? What's up, Julian? Magara, good to see you. Hello, Happy New Year. Hey, Patty. Hey, Amanda. What's going on, Deanna? Great to see you, Mana. I love where you guys are jumping on from. Scotland's in the house. West Virginia's in the house. Pablo, Colorado representing. We got Florida here. Good morning, everyone. Aaron Boster here. Simone representing the D. Hamburg, Germany is in the house. What's going on, Terry? Happy New Year's to you and yours. Diane, that's fantastic. As you jump online, tell me where you're jumping on from. This is Aaron Boster. I'm actually on a vacation right now in the Caribbean. I couldn't help myself. Had a little downtime, was missing everybody, and wanted to jump online and say hello, howdy, hi. UK London's in the house. Ireland is in the house. That's fantastic. Happy New Year, Courtney. Courtney, where are you calling in from? Martin, that's a great question. When we turn the cameras on, I'll answer it for you. Allison's representing Yorkshire, England. Barbados is in the house. What's going on? Shannon, the Caribbean's gorgeous. Hey Jesse, this will be a Q&A once I turn my camera on. Scotland's in the house, Michigan representing. Hey Amanda, it's good to see you. Rune Larson, hello, Happy New Year, all the way in Norway. Indiana's in the house, what's going on Ryan? Great to see you. Alaskan and Fort Worth, a little bit different weather there. Always Jen, always. Greetings from the Netherlands, right back at you. Heath is in the house. Let's see if we can get to 75 people and we'll turn the camera on. I'll give it a little bit more time. I love when this growing global online village amasses. Sandra Ramsey, great to see you. I hope you're enjoying Arizona. Mexico's in the house. What's going on, Kathy? Hey, Sarah Woods, so good to see you. Jim, it's great to see you. I hope you and yours are doing well. Happy New Year's to you, my friend. Charles is in the house representing North Carolina. Welcome, everyone. Happy New Year's to all of you. This is Aaron Boster. I'm actually on a Caribbean vacation, loving the sun. I thought I'd take a few moments and jump online and say hello, howdy, hi. Gus representing Athens, Greece. Gus is an OG. Always love to see you here, Gus. Lisa's in the house, Kansas representing. We're almost at 75 people. That's the magic number for us to go live and start to answer your questions. We'll run an Ask Me Anything Multiple Sclerosis. I'm so excited to connect with you in this impromptu Ask Me Anything live stream. Sarah, we just hit 81. Let's jump in and do what we do. Now guys, before I turn my camera on, you know how we do it. Flame up the chat real quick like a bunny rabbit. Flame up the chat. Go ahead and spam that flame button. Let's flame up the chat and show the algorithm that you're excited to be here. Once we get that chat flamed up, I'm gonna start the intro. Sarah Woods has got the right idea. Shannon's leading the way. Amelia's leading the way. Let's get the whole chat flamed up. Jesse's in the house. Carrie Perry's got flames going on. Go ahead, guys. Flame up that chat for me. Carl's got it going on. Yeah, Sarah, hit that button. Jen's got it going on. There we go. We just flamed the entire chat, and you know what that means. Hey, hello, howdy, hi, everyone. Aaron Boster here. It's great to see you. Happy New Year's to everyone. I can't believe it's 2025. That blows my mind. I think I started this YouTube channel 10 years ago. Kind of makes me feel old. I think if you go back and look at old videos, I don't have any gray. And I probably had more hair on top. Good morning, everyone. Good evening, or depending on where you're jumping on from. This is Aaron Boster doing an impromptu Ask Me Anything live stream. I'm so excited to join you today. Sarah's representing Phoenix, Arizona. Welcome, Sarah. Welcome, Susan. Welcome, Jen. As you jump online, of course, share with me where you're jumping on from. I love to go back through this chat and read through where this growing global online community has jumped on. Lisa, do go on. Thank you for the kind words. Simone is in the house. There's 90 of you that have jumped online. Thank you all for being here. Hello, howdy, hi. Is creatine beneficial for MS? They say it's good for cognition. Creatine is not just a joke. It's not a silly supplement. Creatine is real. It's on the list of things that has decent research. Creatine is used in the setting of competitive sports to help recovery and build lean muscle mass. Creatine has some data suggesting it can help with energy in the setting of multiple sclerosis. Creatine feeds the Krebs cycle, and I think it's a legitimate supplement. I'm also very big with suggesting protein for people impacted by MS. Now, creatine is not a complete protein, but I don't see any harm or any issues with taking a creatine supplement. You know, whenever I think about a non-allopathic medicine or a supplement or a vitamin or a remedy like that, I always keep three things in mind. It can't be too expensive, and only you know whether a creatine supplement is too expensive for you and your family. It can't be dangerous, and as long as you have intact kidney function and you don't overdo it, I don't really think we're going to have a lot of danger associated with creatine. And then it can't be instead of something that I know works. So if you said, hey, I'm going to stop my Tysabri and I'm going to take creatine, I would be upset by that. Sorry, there's some beeping going on in this condo. But if those are not the situation that we're in, taking a creatine supplement, particularly as part of a healthy, complete diet, I don't think that's going to hurt anybody. Sarah Woods says, Medicaid covered my modafinil. That's fantastic. I'm really glad to hear that. I just thought I would jump online. I'm really excited to get a chance to connect with all of you. I'm on a vacation. I'm really excited about that. When I started the Boster Center for MS about 5 years ago, there were no vacations for a couple years. We were grinding, and it's really nice to take a deep breath, to get to see a blue sky, to get to walk on a beach for a moment and rejuvenate and recharge my battery before I jump back at it in clinic. But I missed you, and I wanted to reach out and say hi and answer some of your questions. So thank you to all 118 of you that saw fit to jump online on this beautiful Thursday, January 2nd, 2025. It's weird to say 2025. I know I'm going to write that wrong for a long time. Let's take a couple questions from the audience. I'm looking through the chat. So here's a cool question. This question comes from Jesse, who says, my general doctor scheduled an EMG. I've been waiting months for a neuro appointment. Is an EMG helpful for MS? No. So an EMG is electromyography, and it measures two things in the nervous system. Now, to explain it, we neurologists divide the nervous system in half. The central nervous system, brain, optic nerve, spinal cord, and then the peripheral nervous system, which is all the nerves that come off the spinal cord, and then how the nerves interact with the muscles, as well as the autonomic nervous system. So an EMG nerve conduction study is a procedure typically done in an EMG laboratory where there's two parts. The first part is the EMG technician will put stickies on your arm or your leg, and then they zap you with a small amount of electricity. Now, you're not getting electrocuted. It oftentimes feels like when you touch the doorknob and get a little zap. And what that zap is doing is it's measuring how quickly electricity runs down the nerve. And it can tell us whether the nerve is functioning normally or if the nerve has been damaged in some way, and exactly how it's been damaged, whether that's an axonal or a demyelinating problem. Again, we're not talking about central nervous system, we're talking about peripheral nervous system. The second part of the EMG nerve conduction study involves a little tiny needle. And when I say tiny, I'm talking like acupuncture tiny. And it's attached to a wire, and on the other end of the wire is a squawk box. So you put the needle in the muscle, and when you flex the muscle, you can hear how the muscle and the nerve talk. You literally hear it. There's a crackling sound, and those crackles can teach you that muscle-nerve connection. So an EMG nerve conduction study is a great way of studying the peripheral nervous system, muscles, neuromuscular junction, the nerves, the brachial plexus, all those kind of things. And it's a very useful test to understand myopathies, so problems with muscles. It's a great test to understand neuropathy, which is not a casual term. That means problem with the nerve, the peripheral nerve, or difficulties with radiculopathy, which is where the nerve roots come right off the spinal cord. But an EMG nerve conduction study doesn't look at the central nervous system, so it has no benefit in helping us understand the brain and spinal cord or the optic nerves. It doesn't teach us about that. Sometimes when someone's having a problem neurologically, let's say, for example, they have a numbness, getting an EMG might give us a sense of, is this a peripheral problem or is it a central problem? If somebody has, let's say, a numbness in their leg and you do an EMG and it's normal, that might suggest, hey, we don't see a peripheral nerve problem, so maybe it's in the central compartment. That's stated as part of my MS workup when I'm trying to help figure out if someone has multiple sclerosis. I normally don't start with an EMG, and I would say I don't need an EMG 99% of the time. So it's a very useful test, but it's not a super useful test when you're trying to work up multiple sclerosis. Now, Jess, that was a great question. Thank you for asking it. Let's take another question from the chat. Let's try to figure out where I am here. So Sandra Ramey says that her last brain MRI included a report done by artificial intelligence, AI. It pinpointed where all the lesions were, 19 lesions. I never knew the number or exactly where they were until the report. And so that's pretty interesting stuff. AI, I think if we went a generation back, I think a lot of us thought that AI was going to create robots that did things like dig ditches or do manual labor. And that is not the way AI has been developing. AI has been doing a lot of cognitive processing type stuff. And looking at things like ChatGPT, it's freaky and scary. We use AI in our MRIs. In specific, I use a program called NeuroQuant. That's a proprietary software that I use. And it measures brain volume. It measures the size of your brain compared to people, your gender and your age. And it gives me a sense of how big your brain is compared to people your age and sex. And it takes it a step further. It can break down the different parts of the brain. So it can measure the thickness of the cortex and the width of the third ventricle and the size of the thalami and all these different brain structures. And that's generated by AI. There's a parallel software that I don't use, but I find it really interesting, called LesionQuant, which does kind of what you're talking about here, Sandra, where it color codes the lesions and shows you them and can show if they've gotten bigger. Now, I'm old school and I still look at every single one of my MRIs and I compare it side by side with an old MRI. So I'm looking at new and old side by side. And that's what these AI programs do. Do I think AI will replace radiologists? No, I don't. Do I think that they will increasingly aid radiologists in their read? Yes, I do. And I think that's already a reality. That's a really cool application for software, in my opinion. Thanks for bringing that up, and that was a really interesting point that you brought up. Now, I'm a little bit parched, and you know what that means, guys. When I drink, you drink. This is the MS Water Challenge, so drink up. That's pretty good for desalinated water. Let's see here. So Valentine shares, This month, I'm going to make I'm going to make Kesimpta 2 weeks after my normal date. Is that problematic, the delay? I'm taking it every 26 days since 2023. So the traditional medical disclaimers: I can't give you medical information. You're not my patient. You need to talk to your doctor about what's right for you. All that stuff, right? So I've said all that. And the way that Kesimpta has been invented, it's intended to be given every month. And so the party line would be, please take it every month. That stated, I don't think it's a problem. The B cells don't come back that quickly. And because you've been on it now for, about a year and a half, I suspect that taking it 2 weeks late is not going to throw you into a tailspin. So again, I can't make specific comments for you, and of course you need to talk to your doctor, but if I heard that from one of my patients in that situation, I wouldn't be very concerned about it myself. That was a good question. So here's a question from Crystal Lee, which is a cool name. Makes me think of a favorite Billy Joel song of mine. After optic neuritis diagnosis, is it normal to periodically feel pressure in the eye? Also, are optical migraines MS related? So that's two really good questions. So optic neuritis, if we break that word apart, itis means inflammation. So neuritis means inflammation of a nerve. Which nerve? The optic nerve. So optic neuritis is inflammation of the nerve behind your eye, and that's what light travels through to get back to the brain so that you can see stuff. And when there's an optic neuritis, that nerve swells, and two things happen. One thing that happens is when you move your eye, it tugs on that nerve. So if this is my eye and this is the optic nerve and it's in bone, when you go like that, you can imagine it's tugging on that nerve and it hurts. And so people that have an optic neuritis can notice pressure and pain with moving their eye. The second thing that happens, because the optic nerve gets swollen as part of inflammation from optic neuritis, is that the light message traveling through doesn't get there. And so they can have a diminished vision. And with time, and oftentimes with steroids, that optic neuritis will quell. The inflammation will die down. Can you have periodic uncomfortable sensations after optic neuritis? Yes. And many of my patients that have suffered an optic neuritis, they'll share that with me periodically, particularly if they're overheated or if they're really, really tired, or if they have an infection. They might notice that the optic nerve is kind of short-circuiting and it may hurt again a little bit, or it may hurt when they move it, or they may even have a little diminished vision again. Typically speaking, that goes away whenever that inciting phenomenon dies down. So when they're rested up or when they're no longer febrile, that gets better. If it's going on for more than a day, I most certainly would definitely bring it to the attention of your provider just so they can take a peek. Now the second question is, do people impacted by MS have optical migraines? So a migraine is a type of headache, and an optical migraine oftentimes is referred to as a phenomenon without an actual ouchie-yaya headache where you see kind of shiny lights in your visual field. Now sometimes an optical migraine can go on to involve head pain afterwards, but not always. And what I would say is people impacted by MS are much more likely to experience migraine headaches compared to the general population. So I don't think that's specific for ocular migraines, but I do think that, or I know that people impacted by MS are at higher risk of having migraines in general. Great questions. So Jesse says, Happy New Year from Minnesota. It's great to see you here. And let's make it a relapse-free year, and I think that's a great goal. In 2025, I don't think the goal as it relates to relapses is to have less relapses. I think it's to have no relapses. And with our most new disease-modifying therapies out there, I think that's a very realistic expectation, that after you've been on the drug long enough that we can expect it to be working, I think that it's reasonable that we should demand no relapses. So if you're on an oral birth control pill and you get pregnant, then it didn't work, because the goal of an oral birth control pill is to prevent an unplanned pregnancy. If you're on a disease-modifying therapy, particularly the newer high-efficacy disease-modifying therapies, and you've been on them for longer than, say, 6 months, the expectation should be no relapses. And if you have a relapse, that's very disconcerting, and I think that's a discussion about whether you should stay on that or not. So Melissa Althouse says, needing to change from Tysabri to an oral DMT, what would you suggest? So For starters, I don't have a lot of information and I have a lot of questions. Why do we need to go off Tysabri? Is it no longer paid for? Is there a problem with venous access? Did the infusion center close? Is it no longer safe because the JC virus has gone up? Is it actually not safe, or is the provider just nervous about the JC virus? So have you had an attack on Tysabri? Do you have neutralizing antibodies against Tysabri? Because the answer to that question would change my response. But putting that aside, without that piece of information, let's just take the question at face value. For whatever reason, there needs to be a change. Now, my second question is, why does it have to be an oral agent? We could make a lateral move from one high-efficacy monoclonal antibody to another high-efficacy monoclonal antibody. So we can go from Tysabri to a B-cell depleter, for example, and that could be Kesimpta or Briumvi or Ocrevus or rituximab or Truxima. And so I don't know why it would have to be an oral agent. The reason I ask that is, in my mind, the oral agents are a step down in the efficacy of disease-modifying therapies from monoclonal antibodies like Tysabri. But let's take that at face value and say, for whatever reasons, we really do have to go off Tysabri and we really do have to go on an oral agent. I would be looking very carefully at Mavenclad. I personally think Mavenclad is king of the pills. It's probably my favorite of all the oral disease-modifying therapies. And so that's the direction I would go in. That's just my own personal opinion. There are other options, but you asked me and that's my answer. Let's change the scene up a little bit. I think some calm breeze sounds really good. I hope that you like this scene as much as I do. I think it's kind of fun and relaxing. Let's take a question here. Whoops, sorry, I'm jumping around. I don't know if you guys know this, but I'm dyslexic. And so things that are really hard for me are columns of numbers and trying to track words on a screen. And so when I do these live streams, it's always quite a challenge for me to try to track what I'm reading. That's why I'm so appreciative when the moderators are online and they can throw the questions up for me. So if I skip your question, it's not because I'm not interested in answering it, it's because I lost my place. Let's take a look here. So Vivian writes, question, how concerned are you about the JC virus on Ocrevus? I'm not concerned at all. So the risk of contracting PML, which is the infection that you can get from reactivation of the JC virus in the brain, while on Ocrevus is the same as the general population. So I am not concerned about that. In fact, oftentimes when someone is on, say, Tysabri, and they become a high JC virus antibody titer, where we are concerned about possible risk of PML, I will switch them to a B-cell depleter like Ocrevus as a safety maneuver. So Mama Bear writes, hey, Dr. B. Well, hello, Mama Bear. My walking and spasticity have significantly improved since finishing year 1 on Mavenclad. I'm not complaining at all, just curious. How does that happen? So I don't have a great answer, but I can give you a hypothesis. So these different disease-modifying therapies work differently. And we are not, meaning neurologists, aren't smart enough to know ahead of time, Mama Bear is going to be a responder to drug X better than drug Y. We don't know that. And if you had unchecked ongoing inflammation on whatever you used to be on, and then Mavenclad worked, and it finally quelled this smoldering inflammation, we can see an amelioration of symptoms. And I know that's not a very scientific answer, but it fits with my clinical experience, that sometimes we'll be struggling to find a medicine to control someone's disease. And when we finally nail it, not only do they stop having attacks and new spots on their MRI, but also we'll notice that yucky symptoms seem to improve. And all I can come up with is that by quelling the inflammatory milieu, we can result in people faring a lot better. So I'm really glad to hear that things are better. That's really awesome. Congratulations. I hope that you leverage those benefits to exercise as part of your lifestyle. Because with less spasticity and with better walking, that opens up an opportunity for you to hoof it and to build leg strength and muscular endurance, to build limb flexibility and to improve your balance, which is going to help you for years and years to come. Calamity Girl writes, my cognition symptoms are getting worse, which affects my speech. I use filler words all the time, and it gets worse at night. What can I do to help this? So first of all, Calamity Girl, you're not alone. It's very common that people impacted by MS can develop difficulty with cog fog or thinking and memory. I would say that upwards of 70% of people impacted by MS have some difficulties with thinking and memory. Now, this is not an Alzheimer's dementia. You're not going to one day not know who you are, who people around you are. You're not going to get lost in your neighborhood. Those kind of things don't happen. But what we can identify is difficulties with executive functioning, difficulties with rapidly processing things or working under time pressure, multitasking, sometimes word-finding difficulties. And that can be really, really frustrating. And so I want you to know that you're not alone in that, not at all. So I'm trying to adjust my camera here. So I have a bunch of videos on this channel about cog fog and about ways of combating it. In fact, I just recorded a video where I talk about cog fog and things that we can do to improve it. And that video is going to be launched in the next month or two. I forget exactly which Monday I have it set up for, but stay tuned because the video is locked and loaded. So it's going to be coming out in the next 8 weeks sometime. And I'm really excited to share that video with you. There's a bunch that are already on the channel, and there's actually a playlist on cog fog and thinking and memory and MS. And so I would encourage anyone that has concerns to check those videos out. Now, let's talk about some things that we can do. The fact that it's worse when you're tired at the end of the day is very relevant because cog fog, which for you is manifesting as word-finding difficulties, is very related to fatigue. And as the day goes forward and as you start to use up all your cognitive energy, it stands to reason that you're going to have more difficulty with thinking and memory, and you may have more difficulty with word finding. So one super tip is to make sure that you're getting adequate sleep at night. If you lack restorative sleep, you're cutting your cognitive legs off before you even start your day. And so if you're waking up, going to the bathroom several times, or having spasms or cramps, that's going to impede your restorative sleep. If you're only budgeting for 5 or 6 hours of sleep, that's going to impair your restorative sleep. If you have obstructive sleep apnea and you're waking up snoring or wake up with a headache, or if you have restless leg and it's hard to fall asleep, you want to address all those things because you want to fill up your cognitive battery so that you have plenty of energy to help you get farther along in your day. Along the same lines, I would recommend using a power nap. So you could recharge your battery. And let's pretend that you have a large function in the evening where you have to be on point, and it's really important. Budget time, may even take an hour or two off work, come home early, get your snooze on, and take an hour nap and recharge your battery. And what you'll find is you've kind of refilled your cognitive reserves, and you'll fare a lot better. Other things that you can do, you can be open and honest with the people that you're talking to if you're comfortable and say, hey, listen, my MS is not the best today, and I'm having a little bit of difficulties with my words, so bear with me. If I stumble, I'll get to my point. Just give me a moment. And oftentimes, a friend will understand that, and they'll be sensitive to that. And so that kind of takes the pressure off, if you will. Another thing that you can do is you could work with a speech therapist. So you could talk to a speech pathologist who can help you retrain cognition. They sort of do like a cognitive rehab, which can be very, very powerful. And so cog rehab can help you with word-finding difficulties. Another thing that you could do is you could talk to your treating neurologist about taking a stimulant. So oftentimes medicines like Provigil, Nuvigil, Adderall, Ritalin, Vyvanse, these stimulant medicines can trick the brain into being more attentive. They can help combat cog fog. Now, there's a bunch of other things that you can do, but I hope that that gets you started on the right path. And that was a great question. Thank you for asking it. All right. Even So It As Well is on. Hello, howdy, hi. Even So It As Well is a wonderful moderator. She's a great gal who has her own YouTube channel. And so if you haven't checked out her channel, definitely click the link in her name and follow along. And maybe Even So It As Well, you could throw a link up to your channel so that people can easily find you. Thanks for being here today. Happy New Year's. So Sonia B says, RMS versus PPMS or PMS. Is there a better treatment than Aubagio? Yes. So I'm speaking in gross generalities, right? So I'm speaking in just, all comers. When you compare the efficacy of medicines, there are medicines that have better relapse rate reduction, they have better MRI data, and they have, in some cases, better data for progression of disability than Aubagio. That stated, Aubagio does have a role in my practice. Aubagio does a better job with slowing brain volume loss and slowing progression than it does with stopping relapses and new MRI spots. So you can imagine someone who isn't having frequent attacks, they're not having MS attacks very often, they're not having new spots on their MRI, but they are having accelerated brain volume loss, they are having some progression and disability, and we're concerned about risks of intense immunosuppression. Maybe the person has an increased risk for infections. Maybe they have other reasons why they're at higher risk for concerns like that. And then Aubagio may have a role for them. I use Aubagio sometimes when I'm doing what I call de-escalating, where I'm going from a high efficacy, higher risk medicine to something that is a little safer. But all comers, particularly for newly diagnosed patients, both progressive MS and relapsing MS, I don't start newly diagnosed patients very often on Aubagio. It is a medicine that I like, and it does have a role, and I do use it quite a bit in practice, but I hope that answers your question. Thank you for asking it. All right, what else we got cooking here? So, I'm not sure I can pronounce your first name correctly. I'm going to say Lydia, which is probably not right. And so if that's wrong, I apologize to you. But LC says, I got 6 new lesions after my first round of Mavenclad, first DMT. Is this caused by the Mavenclad or something else? So I do not think that disease-modifying therapy, particularly Mavenclad, causes new spots. The goal of Mavenclad is to stop new spots. But when you got the MRI is relevant. So for example, if you started Mavenclad and then 3 or 6 months later you get a rebaseline MRI and see new spots on it, we don't know when those spots occurred. They could have occurred right before you started Mavenclad. They could have occurred a week after you took Mavenclad. And oftentimes, if I start someone on any disease-modifying therapy and then I get a rebaseline scan and I see new spots, I'm not going to throw the baby out with the bathwater just yet. I'm going to repeat that scan 3 to 6 months later. Now, if on the repeat scan we're still seeing new spots, now I'm very, very concerned. The second thing that's relevant is the way that Mavenclad works, is it's really a 1-2 punch. You take your first 2 months, and then a year later you take your second 2 months. And so until you've gone through the 2 cycles of Mavenclad, year 1 and year 2, you're not fully treated. Now, that doesn't mean that I would just rest on my laurels and not worry about it too much, but it doesn't mean that I would consider Mavenclad an adjunct failure at that point. Those are things to keep in mind. Now, is it okay to have 6 new spots? Never. And does that need close observation? Yes, it does. Does it mean that you have to quit your Mavenclad? Not necessarily just yet. But I think that at bare minimum, you want to repeat a scan soon to make sure that everything's copacetic. What about natural ways to help, like vitamins and such? So I think that diet matters, right? I think that nutrition is really important. I put out a video maybe a month ago where I said food you eat worsens MS. And if there's a moderator on, maybe you could throw a link to that video. It's done very well. I think you guys seem to really like it. It's got 10,000 views so far, which is pretty good for this channel. And I talk in specific about the concerns of ultra-processed foods. Nutrition matters in MS, but it's not an or, it's an and. So are there natural ways to help slow down multiple sclerosis? Yes, but I don't think that they're adequate by themselves. So in addition to a lifestyle of exercise, in addition to daily practice of mindfulness, in addition to not smoking cigarettes and paying attention to cardiovascular risk factors and brain health, in addition to taking a disease-modifying therapy, eating smart is really important. So what does that involve? Well, for me, that involves avoiding sugar-laden foods, fried foods, fast foods, diet foods. That involves avoiding foods that have ingredients that you can't pronounce. So if you look at the back of a wrapper and it has a bunch of chemicals, names that you can't pronounce, that's not food. Because you know all the food words, apple, asparagus, chicken, fish, those are foods. Dimethyl frappadapalapa, that's not a food, that's a chemical made in a lab, and I don't want you to eat that. paying attention to eating single ingredient foods, minimally processed foods or unprocessed foods, paying attention to whole foods, I think is really the way to go. And adding colorful vegetables and having salads and doing things like that is not to be poo-pooed. It's actually very, very important. Upping your water game is very important. And speaking of such, I'm a little parched, so you know what that means. When I drink, you drink. It's the MS Water Challenge, yo. Now, vitamins and minerals are important, and I recommend vitamins frequently to my patients. I recommend that most people would benefit from taking a multivitamin because our diets aren't perfect. I recommend that people supplement vitamin D3. And there's a host of other vitamins that I've talked about on my channel that I think can be of value to someone. But again, I really want to stress that it's an and, not an or. And as part of a healthy diet, I think adding in some supplements can really be of value to you. But I wouldn't do that while I ate McDonald's and drank Diet Coke and then wondered why I wasn't getting better. So thank you for that question. That's a really good one. Michelle asks a great question. Is Empira good? Yeah, Empira is really good. So Empira, or in Europe, Fampira, 4-aminopyridine is the generic name, is a symptomatic medicine. It's not a medicine to slow multiple sclerosis. It's a medicine to help with a very particular set of symptoms, which are kind of unique to MS. And those symptoms are motor fatigue and heat sensitivity. So I've got videos on my YouTube channel that explain exactly how this works, how Empira works. Excuse me. And I won't go into the details right now, but if you're curious, I have a playlist on this channel, which is called Temperature-Related Symptoms, where I kind of have some diagrams and I break down for you the mechanism of Empira. But when Empira works, and I would say it works about a third to half the time when people take it, they have nearly a Lazarus effect, or like a wow, where they go out in the heat and they don't melt. They don't get weak in the heat like they used to. Or they get their exercise on and they're heating up their core body temperature and they don't melt. And it buttresses against heat-sensitive symptoms, which can be really, really helpful. Now, not all patients respond to Empira, and we doctors aren't smart enough to figure out who responds and who doesn't. So what we have to do is give it to you for about 2 months, and then you tell us. And I warn people, or I don't warn people, I tell people, you're either going to say, wowzers, that was amazing, and then you won't let me take the Empira away because it works so darn well. Or you're going to say, ah. And if you say, ah, then it probably didn't work. And then we would stop it. Also, Empira is metabolized by your kidneys. And so if you have a kidney problem, then it might be a dangerous medicine for you. Of course, you have to talk to your doctor about that. And Empira can lower the seizure threshold. So if you have a seizure disorder, that's a no-no medicine. Interestingly, Empira was originally invented not for humans, but for pigeons. And it wasn't invented to treat heat sensitivity, it was invented to kill them. And so Empira was a pigeon poison that we would sprinkle on the rooftops in New York City, and the pigeons would eat it and seize and die. And some really smart men figured out that at lower doses, it would really help MS motor fatigue. So that's kind of a crazy beginnings to that medicine, Empira. Great question. All right, let's see what else is cooking. Matt, that's really nice of you. Super thank you for being here and supporting this channel. I started this channel about 10 years ago, which is crazy. And the reason I started the channel was to educate my patients and their families between visits. It dawned on me that if I saw you 4 times a year, that's twice as often as the standard neurology practice. And that's not enough. You know, I'll spend, say, an hour with you, right? So that's maybe 4 hours a year. That's not very much time. I'm trying to help you live your best life and trying to help you figure out how to make MS boring. And I have at maximum 4 hours in a year to do that. So if you think about this, so I'm a student of the game of chess. I love the game chess. I'm not very good at it, but I really like it. And if I came to visit you and I spent a half an hour to an hour every 3 months teaching you the game of chess, you would stink at chess. You wouldn't be very good at chess. That's not enough time for you to learn the complex game of chess. Well, MS is more complicated than chess, and I need more time to help up your game. At the same time, I realized that as a non-surgeon, as a neurologist, I help you by request. So I don't anesthetize you and cut out a tumor and sew you back up and say you're welcome. I ask you to take a medicine, for example, or I ask you to participate in a physical therapy, for example. I ask you to get an MRI and let me look at it. I'm treating you by request. And if I can't explain to you why I want you to do something, I can't expect you to do it. If you tell someone, stop smoking, they're going to say, no. If you say, smoking speeds up MS by 50%, and I would like to try to help you quit smoking, they might listen to you. So I realized that YouTube videos was a really cool way to reach people at a time that's best for them. That's the other thing that I realized a couple years back, that I schedule time to see you in clinic when it's convenient for me, which does not mean it's convenient for you. And I am prepared to tell you whatever messaging I need to tell you at the time I see you, but you may not be ready to hear it. So if I can make a video on that topic, I think I'm telling you the truth. And so I'm comfortable referring you to me so that you can learn at a time that works best for you. So thanks for those kind words. Now, this amazing moderator, Even So It As Well, is doing a great service, and thank you, madam. She's put a link there to the Boster Corner. So the Boster Corner is a free monthly newsletter put out by the Boster Center for Multiple Sclerosis, my center. And it's a monthly newsletter that kind of gives you the latest and greatest. We typically write an article every month, something about MS, oftentimes sharing updates on research opportunities and exciting things in the field. And we share when I do all of my live streams. And so we just set up a schedule to do a monthly live stream for the entire 2025. And if you would like to know when those live streams occur, please click that link. It's free to sign up for the Boster Corner. If you don't like it, you can cancel the subscription. And it's just a free e-newsletter that we put out at no cost to you to keep you informed about MS, to tell you the latest and greatest at the Boster Center for MS, and also to tell you when I go live. So let's see what other questions are cooking here. Let's change up the scene just to be sassy. I love this scene. I hope that you like it too. So this is the tablet scene. And let's see if there's a question here. So Kevin says, what are your thoughts on immunomodulatory mushroom tinctures like reishi, lion's mane, turkey tail, cordyceps used in conjunction? So first of all, that's a really interesting question, Kevin. But the second comment is they're not immunomodulatory. So those are called functional mushrooms. When you look at mycologists that study mushrooms and educate about mushrooms, those mushrooms are called functional mushrooms because they can do various things to the human body beyond tasting delicious. And I think that functional mushrooms are really, really interesting. I have studied functional mushrooms quite a bit because I'm fascinated by them, particularly lion's mane. Now, it hasn't been studied very carefully in MS. And whereas Western medicine doesn't use functional mushrooms very often, they're used in Chinese medicine routinely. Now, lion's mane in specific has some data to suggest that it can help with cognitive function. It's not gospel proof, but it's very interesting. What it does at the level of the brain is fascinating. It provides neurotrophic factors for brain growth, and it actually mimics other neurotrophic factors for brain growth. Now, there isn't rock solid data, but again, I go back to my general guidelines for non-allopathic medicine. Is it dangerous to take a functional mushroom? No, it's not. As long as you're not an ant, cordyceps is not going to hurt you, and those other functional mushrooms are not going to hurt you. Is it expensive? Well, only you know whether that's too expensive for your family. I would say that most people can afford functional mushrooms, and so that's normally not a barrier. And is it done instead of something that we know works? So as long as you're taking a functional mushroom in addition to your disease-modifying therapy, giddy up. Now, if you said, I'm going to stop my fill-in-the-blank DMT and I'm just going to do functional mushrooms, I would be very concerned about that. There are lots of different ways of taking functional mushrooms, and one of the things that I want to point out is quality matters. One of the big issues that I have with any non-FDA approved supplement is that we don't have any quality control. And so that's a risk, that you could be taking a pill that says cordyceps, or it says turkey tail or something like this, and you don't know if it actually is. And so trying to find a reputable distributor is important. I stumbled upon a company, I have no financial link with them. They're called Fresh Caps out of California. And Fresh Caps is very real. They do a bang-up job. They grow all their own functional mushrooms, and they're available online. They have a lot of educational content on their website, and so check that out. Again, I don't have a financial relationship with them, but I think they're really cool. And that's where I would get my functional mushrooms if I was going to do that. Alternatively, you can grow those mushrooms. They're not actually terribly hard to grow. And so that's another option that you have. That was a great question. Thanks for asking it. Speaking of websites, I don't know if you guys have ever visited the Boster Center for MS. So we have a website that I'm really proud of, bosterms.com. I'll put that in the chat. So if you haven't ever checked out the website, go there and you can check it out. You can learn about the Boster Center and kind of what we do. We care for families impacted by MS from around the globe. I'm very proud of the team that we have working there. And so check out that website if you haven't had a chance. So let's see here. Ruben has a question about CBD gummies in MS. Is it useful for energy or stress? So CBD doesn't have very much research or data to support its use at all. That makes it difficult to answer that question. Anecdotally, I think CBD helps with a couple things. I think that CBD helps with anxiety. So I have patients that use CBD gummies to help with their anxiety. I also have found that CBD gummies can help with insomnia. And so those are the two biggest things that I recommend CBD for. I'm a big fan of CBD gummies, particularly for insomnia and for anxiety, because you can take them before bed or when you need them throughout the day, and they don't generally make you somnolent. I also think that some CBD can help with some types of neuropathic pain. And so sometimes a topical CBD rub can really help people with neuropathic pain. So those are some things that anecdotally I have found to be true, but I do not have data to support that use. And so you really kind of have to try to find out for yourself if it works for you. So Even So as well is just crushing it today. So she threw up the link to Fresh Caps, that company that I mentioned that sells reputable functional mushrooms. Thank you for doing that, madam. All right, let's take another question from the chat. So H-Mom said, asked for natural ways to treat MS or things to support treatment and quality of life. The doctor said didn't have any knowledge about that. And the doctor was probably being honest. Allopathic medicine is not the end-all be-all. And allopathic training, so learning about pharmacology and biochemistry and pathology, isn't the answer to every single thing. And there's big gaps in allopathic education. So we don't learn enough about the value of exercise, and we don't really have very good education in nutrition. We don't have very good education in mindfulness and things like that. And that doesn't mean that those things don't work. It just means that we need to think sometimes beyond the traditional allopathic education when we're trying to live our best life despite having MS. And again, I come back to it's an and, not an or. I'm very fond of reminding people that I want you to be 5 for 5 in your fight against MS. All right, so being 5 for 5 in your fight is my way of reminding you that there are 5 things I'm aware of that slow down MS. So the first one is brain health, not smoking, not being morbidly obese, not being inactive, treating diabetes and high blood pressure and high cholesterol. Come on now. Those things matter, and they can slow down the progression of disability. Number 2 is eating smart. And so we've already on this live stream talked about eating smart a couple times. And I've got a lot of videos on my channel about eating smart and what that means. Number 3, 1, 2, 3, good job, Aaron. Number 3 is exercising as part of your lifestyle. And if you don't think that exercise matters, you're missing the boat, because I would submit that exercise is one of the most powerful disease-modifying therapies out there. It's probably the least appreciated disease-modifying therapy out there. Number 4 is the daily practice of mindfulness. So I define mindfulness as being in the present moment without prejudice. So I always joke, if you're having sex and you're thinking about work, you're doing it really wrong. You need to be in the moment, thinking about the moment. You want to be doing an activity and not worrying about something you missed yesterday. You want to be doing an activity and not worried about what's going to happen tomorrow. You want to spend just 5-10 minutes a day mindful. And the reason that's so important is because stress worsens multiple sclerosis. I put out a video talking about a paper that kind of proves that. And when you have a situation, life, which can be stressful, we need to cultivate techniques to improve stress management. And so mindfulness is a great way of doing that. Number 5, being 5 for 5, is to take the most potent disease-modifying therapy that you're comfortable taking and make sure that it's working. Now, a very narrow-minded allopathic MD may only be thinking about that one thing, the disease-modifying therapy, but I remind you that's one of 5 things. And if you're going to make MS boring and live your very best life despite having MS, I think we need to do all 5. So I'll throw the question back to you. How many of you on this chat right now are 5 for 5 in your fight? If you are impacted by MS, throw a number in the chat. Tell me if you're 1 for 5, 2 for 5, 3 for 5, 5 for 5. I would like to read your results, and I'm sure other people would as well. Be honest. There's no shame in that game. Everything's a works in progress. But are you 5 for 5? That might be something to reflect on as we enter into this new 2025 year. All right, let's take a look here and see what else is cooking. So Teresa says, should I be concerned if an MRI shows a questionable focus involving the right brachium pontis? So pontis is P-O-N-T-I-S. So the brachium pontis is a structure in the brain stem, and any lesion in the brain stem is concerning. And the brachium pontis on the right can be involved in some motor control and functions on the right. Now, does that mean you're doomed? No. Do I want to see any new lesions? No. Is it good to have lesions in the infratentorium? No. And so I would take that seriously. And so if you're on a disease-modifying therapy and you have a new lesion in the infratentorium, or anywhere for that matter, that's a red flag that something ain't right. And it might necessitate a discussion about, is that medicine doing all the things that we want it to do? So Sarah Woods says, I do mindfulness with my crafting, currently working on diamond art. That's awesome. So diamond art, for those of you that are not familiar, is really cool. You have this tiny little plunger and these little crystal plastic diamond things, and then you have like a picture, and then you pick up a diamond and you put it in the right spot, and you end up making this beautiful kind of collage of a picture. And it involves a lot of concentration. And so I've seen people doing diamond art, and it absolutely is a mindful task. In the chat, throw in some other mindful things that you guys do. I do a shower meditation every morning. I've talked about that on videos in the past, where when I finish my morning shower, I sit cross-legged under the water and I go through a breathing exercise. It's a very important breathing exercise to me. It involves going through a series of attestations that I say. In fact, I was thinking of recording the breathing exercise so that people could kind of do it with me, listening to it and doing it themselves. I'm not sure if people would want to do that or not. Maybe if that sounds interesting, let me know in the chat. But I want to know what things you do for mindfulness. I'm on vacation right now, and after this live stream, I'm going to put on my sandals and my adventure hat, and I'm going to go for a walk on the beach. And I'm not going to bring headphones. I'm not going to bring an earbud. I'm just going to take in the waves and the sand and listen to the sound of kids laughing and playing on the beach. And that's a mindful activity. Meditation is a mindful activity. For some people, Bible study is a mindful activity. Yoga is a mindful activity. Getting a massage can be a mindful activity. You can turn anything into a mindful activity. So throw a comment in the chat about what you like to do that's mindful. I would love to read it. So TVDB writes, question. So that would be like 5 questions. If I'm on a disease-modifying therapy and I have a new lesion on the MRI, Is that almost an automatic that we need to switch drugs? No. But I think it's an automatic that we have to talk about if we should switch drugs. That should prompt a discussion about switching drugs. And the way that I would typically proceed in my clinic is I would either do one of two things. I would switch to a more effective drug or a drug of a different class that I think might work better, or I would put that drug on warning that that was the one mulligan and that any other new spots or any other attacks, any other problems, we're going to kick that drug to the curb and we're going to get a better drug. And I also would likely re-image that person not in a year, but in a shorter period of time, like in 3 or 6 months, to make sure that I'm not seeing a pattern of new spots. So do I think it's an automatic 100% you got to switch? No. Do I think that it necessitates discussing a switch? Yes, I do. I think that would be really important. You wouldn't just want to sit on that. I think that would not be a good idea. That was a great question. So pray, sewing, crochet, knitting, jewelry, those are all great mindful activities. Savvy says art, mindful activity. Going to the gym, mindful activity. Crocheting blankets, mindful activity. Bird watching, absolutely a mindful activity. There's a bunch of mindful activities. Expressive writing, mindful activity. That's great. These are really great options for mindful activity. So Eugene says, is Kesimpta a high efficacy medicine? Yes. About to switch from Avonex. That's a huge upgrade. Avonex is unfortunately one of the least effective medicines currently available to treat MS. Kesimpta is amongst the most effective medicines to treat MS. Gardening, yeah, that's a mindful activity. Those are great examples of mindfulness, guys. Thank you for sharing them. That's really, really cool. This has been amazing. I'm on this Caribbean vacation and had a couple minutes free, and I missed you guys. I wanted to say hello, howdy, hi, and in particular, Happy New Year. It's really cool that I could turn my camera on and so many of you jumped online to say hello to me. That really warms my heart. I'm going to continue making YouTube videos. I put them out either every Monday or every other Monday. I do a live stream, a formal live stream at typically the last Saturday of every month. And so if you'd like to know when that live stream comes out so that you don't miss those scheduled live streams, you just have nothing more than to click a button, which is in the chat here, for the Boster Corner. That's a free opportunity for a monthly newsletter, which will tell you when I go live. Now this one today was just an impromptu Ask Me Anything because I missed you guys and wanted to say hi. And I'll continue to do this as long as you guys keep watching. Last night we hit 80,000 subscribers, which is insane. I never ever thought that we would see 80,000 subscribers, and here we are. So that's really, really cool. Thank you for being here with me, and thank you for your participation on the live streams. Thank you for watching my videos and for giving thumbs up. That means a lot to me. That really helps out the channel, believe it or not. Thank you for your comments and sharing and participating in this global, glowing online village. It's amazing. I'm going to wrap up this impromptu Ask Me Anything live stream. If I didn't get to your question, please don't be upset. I go back through the live stream and I pull out those questions and I answer them in videos. And I will be doing another live stream at the end of this month. Right now, I'm going to put my adventure hat on and my sunglasses and slather myself in sunscreen. I'm going to go out on the Caribbean beach and enjoy my vacation. So until my next Monday morning video or my next monthly live stream, this is Aaron Boster saying thank you for learning about MS with me. Be safe and take care. Have a great New Year's.